Right, Dr. Emer, we are live.
Alright, you guys. Hey guys, it's Dr. Emer coming really close because my patient is getting a CO2 laser resurfacing. I don't know if you guys remember her before. We did a different laser on her with multiple punch excisions. I know a lot of people actually have been calling in and asking me about them because they don't see a lot of doctors actually cutting out scars. But that's what she needed. A lot of her scars were really deep and they just needed to be surgically removed. So we punched those out and they actually look quite amazing. They're really hard to see. I'll show you on the other side in a minute. We actually have a bunch of them marked. But even here, you guys can see, like in this area, there were some punch excisions and there's almost no sign of a scar. So those linear scars will now be blended into more surface texture and color. And we're just blending the surface. We want her skin to look as flawless as possible, as even skin tone and improvement in the overall texture. So we're doing a CO2 now to blend the punch excisions that we did before. We're doing it super strong because she's lighter skin tone, so that's why in certain areas she will feel it a little bit. We've got her massaging going, she's got her squeezy ball. We're almost done on this side of the face, so she's actually about halfway done. Hold on 1 second, just wait a second. The cool thing is, okay, go ahead. Almost there, almost there. The cool thing is, she's gonna get a really, really amazing improvement. The circled areas where she has some deeper scars, so it'll be a little bit stronger. And just kind of blending on the edge, good, okay. I'll come back to the center while she wipes. I wanna show you guys all of these spots here we marked because this is where the punch excision was. You see right there? It's just kind of a fine line. So I'm gonna start there while she's wiping the rest of your cheek. I'm gonna start in the middle of the lip to really blend a little bit more. Work our way around the mouth. Doing great. Now there are nerve blocks here, but even with nerve blocks, there's still some pain. So she's doing quite amazing. We only have about 5 more minutes, and then we're going to introduce something new. One of my favorite new topical application immediately after laser called PDO Afterglow, you guys. This is a medical cosmetic solution that injects 1,000 basically thin threads into the skin through the channels of the laser to help the laser heal much more quickly and build more collagen. It's also boosted with hyaluronic acid, so we can get a lot of skin plumping. So we're gonna put that on immediately afterwards because I want her to get the best outcome. So you guys can see I cream marked the areas that are here. You can see even here, right here is one of the punch excisions. So we're gonna go over that a little bit stronger. Okay. And so by doing this strong laser and adding Afterglow plus my botanical serum and my hydration mask, we're gonna get like one of the best outcomes and the best healing times ever. And this is something you can use in all areas after you laser. If you're not a laser doctor, I want you to turn that on. Okay, we're just finishing the end. I know you're gonna feel a little bit over here. Keep breathing. Good, you're doing great. If you're not a laser doctor, you can use it after microneedling radiofrequency, derma rolling. So we actually will be having this on virtual consultations at mrscosmetics.com so that you can actually get these to derma roll. All right, keep breathing. This is the hard part. We're almost there. This is the bad part. I can't wait to show it to you guys. So make sure the bottle is there. Is it over there? The bottle as well?
Yep.
For the PDO?
No.
For the Afterglow? Okay, good. Beautiful. Alright, so again, these marked areas where her scars were deeper. So we're going to do a little bit extra there. You guys can see. Perfect. Alright, last part you're going to feel a little this blending in the edge. So the final part, okay? Here we go. It's literally 30 seconds. Not even. There you go. Good. Alright, let me just look at the rest of her face and we'll blend the edges. We're going to go a little bit stronger again over this cheek area where she had, we did about 5 punch excisions here, so I want to get a little bit deeper through here and get a little more blending. Let's get the nose clean. We're going to get the nose and a little scar that she has there. Are you saying anything, Brandon?
Right now they're not, but so who's a good candidate for this treatment, doctor?
Well, anyone that has acne scars with lighter skin tone, darker skin tones can be treated, but they would need to be severely prepped. Almost there. So we would really need to see it, so tell them how to make an appointment.
Yeah, guys, so don't forget to put your full name, number, and email, and one of our representatives will give you guys a call.
So name, email, and phone, and we will give you over to our concierge, and they will take care of you. We'll get you an appointment for a consult. We can do this from far. Remember, you guys can also get skincare. Even if you can't do laser with me, you can get the skincare protocols, emeragecosmetics.com. All right,
That is right, guys.
Last part.
So we have a question. How many days will she need to be out of work after this treatment?
Well, she's going to be peeling for up to a week. So, out of work, I don't know the answer. Depends on the job. But in terms of at home, at least the first 3 days. Okay, look a little bit. I'm going to go a little bit closer just to blend around the eye. Just to blend. Just to give us some anti-aging. Always got to get a little bit of the lower eyelid, you guys. Also, innovative optics. These glasses are amazing. These goggles protect her eyes. Beautiful. Alright, now start just want to just the tip of the nose. Blending everything perfectly. Good. Alright, so we pretty much got everything. I'm excited about that. So now is the most important part. What? Where I want you to apply PRP. You're going to do that while I do the other. So first step, you guys, in our healing process is we're going to apply the PRP. So we're going to get that on the skin. While she does the PRP, I am going to add a little bit of my botanical serum. She's going to rub that in with the PRP. This is the Emer Phytoax C. This is, again, my vitamin C hyaluronic acid combination. Helps you heal. We use it twice daily during laser. Make sure you have a gauze so it doesn't go in her ear. We use this twice daily while laser is healing. Okay, so she's going to mix that in. You guys can get this at emeragecosmetics.com. I use this twice a day just for my skin because I love making my skin look beautiful. This also decreases redness, so if you have rosacea or acne, you definitely want to use this. Where's the afterglow box and vial? The box and the vial. You guys need to get that right now.
And now we're going to be also using our Emer mask, which is definitely going to bring some hydration to her skin.
Last, remember, this is going to push everything in. So I'm waiting. I need that PDO afterglow vial. So in here is highly concentrated hyaluronic acid with 1,000 little microscopic threads that are going to absorb into the skin. This is what's called, we call that the PDO afterglow. It is a polydioxanone thread plus hyaluronic collagen building and plumping. This is a cosmetic solution. In office, the doctors can microneedle this in. You can apply it immediately post laser. So I'm going to start applying this gel. Okay, she's going to just let that rub in. You don't throw too much. Just one layer. Let's get this all rubbed in. And she's going to take a little bit more home tonight as well. But these are thick. This is a thick hyaluronic acid. We want the skin plumping. We want the threads to build collagen. You need this after your treatments. Now, on our website, soon in the next couple days, we will have this live where you can do a virtual consultation and get this at home so you can roll this on your skin with my micro-rolling protocol. So this should be cooling her skin. Okay, so you rub that in. Again, PDO afterglow, amazing. Now the last part and the most important part is let's push these products into the skin. Let's cool her down. Go ahead and give me cold air. Emer Skin Intense Hydration Mask. This has our tea tree extract to get rid of any acne and calm the skin. Licorice root for pigmentation. Citric extracts, growth factors, peptides, and botanicals and hyaluronic. So we're gonna get a little bit of that serum on the skin as well. Okay. We're gonna just put a little bit all over. Good.
Can you tell me, doctor, what's the difference that you've noticed, like before you came out with all this?
Let me tell you guys
your
the
old
difference.
laser patients?
What is so different about using this protocol and or the mask? Less redness, less swelling, quicker healing, calms the skin down more quickly so there's less pain, and overall a better result. People see more improvement in the collagen, in the remodeling of the skin. You need to protect the skin, you need to build the barrier, you need to plump it after an aggressive laser like this. It looks like not a lot happened, but this really damages the skin. So how do you get it to heal? Hyaluronic acid, the peptides, the tea tree that's in here, the licorice root prevents the inflammation and decreases the redness. The botanical serum decreases the redness. And now with the afterglow, we get more collagen. It's literally insane. We are always coming up new, innovative things, you guys. She's going to get a little shaky because the lighting came, but also because of the cold air. But let's see her over the next few days, and her results are going to be phenomenal in a few weeks. You guys are never going to believe 8 punch incisions. You won't even see them. Take care. All right, feel cool with the cold air. You did great. That went really strong.
Thank you.
That goes.
Took you like a chance.